Would you introduce yourself, please?
Sure, I'm HollyMata, and I'm a certified health education specialist as of a year ago. And I'm a doctoral candidate at the University of Texas, El Paso, and I work with the Hispanic Health Disparities Research Center.
And what is your job title?
I'm a student research associate, or I guess a graduate research associate would be the official title. And that's a half-time job with the Hispanic Health Disparities Center.
And can you kind of give a description of your job and in general what you do day to day?
Kind of tough because it changes from day to day, but and that's one of the neat things I think about health education is we're always working on something different. Like just within the last month, we've had projects on nutrition education with the Boys and Girls Clubs, smoking prevention, intervention and research at the Boys and Girls Clubs, sexual health education in collaboration with the Student Health Center at UTEP, and along with Eta Sigma Gamma, we did and worked with the Texas Department of State Health Services for their Kick Butt Stay, which was a big community event. So all of those things involve health education and research, and just depends on what community members need and what research projects need help and what requests we get for health education.
Can you take us through one of those examples and describe specifically what you did and what your role as a health educator was on that project?
Sure. I'll use the example of the nutrition education at the Boys and Girls Club because that one kind of involved quite a few of the student health educators too. And the Boys and Girls Club had applied for a grant through the Texas Department of Agriculture, and it was a grant to implement a nutrition education program that the Boys and Girls Club had developed. And they, to do that, they needed community support and some community partners. And so we at the Health Disparities Center had provided a letter of support saying that we would help them with several of their nutrition education modules using our student health education practicum students. So they ended up getting their grant, and then so my role in that was supervising the practicum students who, using a curriculum that already existed, they tailored it to the needs of the Boys and Girls Club students and came up with some really neat activities and projects that were based on the curriculum but were bilingual and age appropriate and fun for the kids at the same time. And so we had a role in that, in providing that education for the kids. And then we also had a role in helping them at the Boys and Girls Club revise their evaluation objectives because, midway through when they're starting to do their quarterly reports and things, they're finding that the evaluation process just wasn't working because the existing evaluation was only in English, and many of the kids were 6 or 7 years old and had trouble reading to begin with, so it was kind of a pre-test, post-test thing. And so you had kids who weren't quite reading yet trying to do a pre-test, post-test, or kids who didn't read well enough in English to do the pre-test, post-test, and then our health educators were translating, and kind of sit there and think, oh, this really isn't going to work out very well. It's not going to be a very valid evaluation of the program. And so we helped them devise some different ways to evaluate the success of their program, which the Texas Department of Agriculture said was fine and approved and thought was a much more appropriate way to evaluate the education program. So it was really neat because we kind of got to be involved in a lot of different aspects of the program.
You mentioned several of the responsibility areas of a health educator: assessment, planning, implementation, evaluation, and research. In your job position, which responsibility area do you think you practice the most?
Oh, that's a good one. I would say needs assessment. We do a lot of just assessing what the needs are in our community. Also a lot of evaluation and research, just because that tends to be the area that many people have in the community who are doing programs have the least experience with. So sometimes we're called on to help them with that. And then of course in my role as a student, a lot of what I do is evaluation and research. And then I would also say we do a lot of advocacy and community efforts to just increase awareness of health education needs and issues in the area. And so I think advocacy and policy are more and more becoming roles of the health educator too that we're more involved in.
Can you describe your educational background from undergrad all the way through your doctoral studies?
Sure. I got my bachelor's degree almost 25 years ago, and majored in philosophy and religion just because it was interesting, and that never thought about going to grad school or going into health education. But over the years I worked in a lot of different social service agencies and community organizations, and was working as a substance abuse counselor when I realized that I really wanted to go back to school and get more opportunities and be able to do more specifically in the counseling field. And so 7 years ago, I started graduate school and got my master's in counseling and psychology, clinical mental health focus. And at the same time, I had started teaching psychology courses up at HollyMata Air Force Base and started to realize that, there's a whole public health side of mental health and substance abuse that I hadn't really ever considered or thought about working in. And so at that point, I started looking into PhD programs and really kind of wanted to transition into public health and health education, and ended up at UTEP.
Very good. What are some of the challenges of your job aside from working with me?
That's actually the fun part. So probably the biggest challenge is multitasking. That's one. I think a lot of health education specialists, just because the nature of our job depends on changing needs, and so sometimes you may be working with nutrition education one week and sexual health education the next week because there was a need for that in the community. We help support a lot of community partners with their health education efforts, and so sometimes it's just a matter of there's all these ways in which we can involve our students and in which we can get involved with the community. And sometimes it's just a matter of figuring out, do we have enough people, do we have enough resources, and thankfully we have a very active student practicum program, and so the students are able to gain some of the same experience out in the community that really helps them, I think, decide if health education is the field for them. And so that's probably, I think, the biggest challenge. It's just working in so many different areas all the time and constantly responding to changing needs and changing issues.
And conversely, what are some of the rewards of your job besides working with me?
Yes, that's a big plus. I think it's funny because they're all connected. Like, some of the biggest challenges are also the biggest rewards because we get to do so many different things, and we get to work with so many different people and meet so many different people, and we collaborate with different organizations at UTEP. We work with Boys and Girls Clubs, with Red Cross, with Department of State Health Services, with a lot of different community agencies in the area. And so just as it's challenging to continually work on new issues with new people, it's also very rewarding. And we work with all kinds of different populations. It might be elementary school kids one week, it might be college students the next week, it might be middle-aged women who are thinking about certain health screenings or wanting advice on H1N1 vaccinations, so it's just always working with different people and being able to respond to needs in the community, I think, is another big reward.
You said you were a certified health education specialist. For those students out there, what advice would you give them to pass their CHES exam?
Save your textbooks. All those books you have in your health education classes, specifically the
Planning book?
Yes, that one. The planning book, Mackenzie's planning book, are very helpful. And I would definitely suggest doing a practicum. I don't think there's any substitute for the kind of experience you get in different responsibility areas working with different people in the community. I think it's a good idea to take a prep course. It's a good idea to form a study group. The CHES exam is one of those multiple choice exams that just takes a lot of preparation and a lot of study. And sometimes people end up taking it several times before they pass it, and that's fine. But the big thing is to kind of keep that in your sights, just because it really does benefit you and it benefits the profession. And I think it's an important way that we really do set ourselves apart as professionals within the field of health education. And so I would highly recommend it. The opportunities for certified health education specialists are very much worth the time and effort it takes to study for the exam and to take it.
In your experience with working with a variety of health education specialists in the community, could you give us a range of salary for entry-level health educators as opposed to advanced health educators?
Sure, and I'm probably not the best person to answer this question just because I'm a pretty recent health education specialist, and I'm still working with the university. But from my experience, the entry-level range is anywhere from, I would say, from $25,000 to $35,000 a year in some of the community nonprofit agencies, and probably goes up to somewhere between $35,000 and $45,000 for some of the state agencies as an entry-level position. And then from what I understand about some of the advanced health education specialists and their job opportunities, They probably range somewhere between 45 and 60 in some of the government roles. And then, of course, people that go into academia sometimes will combine their health education specialist certification with an MPH or a PhD and end up in a role like you are, where you're teaching the future health education specialists, and faculty salaries can range anywhere from 50 to 70 or 80,000 for people that have been working in the field for a while.
Okay. What is your advice to the future health education specialists out there?
Wow, I would say get your degree, take the CHES exam, and become a certified health education specialist. As you're doing both of those things, take advantage of any of the real-world experience opportunities that come your way. And those can come through doing a practicum. Those can come through involvement with Eta Sigma Gamma, the student honorary organization. Those can come through, there's always opportunities for volunteer health educators with a lot of these community events. And that's really where you get the chance to see what the needs are, to see what issues are really affecting our people here in El Paso, and to work with different agencies and network with people with whom you might end up working when you graduate. So take advantage of as much of the field experience as you can.
And kind of a more broad question, what are the future challenges and directions for the health education profession in terms of training and education and evaluation?
Wow, that's a loaded question. Well, I think more and more, as resources are scarce and funding is harder to get, it's going to be more and more important to have good programs, to be able to evaluate those programs well, and to be able to be professionals in the field of health education, so that we're called upon to do that for groups, for organizations, for government agencies, and as grant recipients. And so the more that we can capitalize on the training that's available to us in the continuing education, and that's another thing about becoming a certified health education specialist, is the ongoing training and education requirements really help keep us and keep our fellow health education specialists abreast of everything that's happening and current in terms of their knowledge of health issues. And so, again, I think it's a matter of we need to take advantage of all the opportunities that come our way for training and for education, and just use them, capitalize on them, and those will benefit our profession and our communities.
And can you describe how you think the Hispanic Health Disparities Center models excellence in health education and evaluation in terms of the framework they use?
Well, I think the framework they use, which is really a social ecological and social justice model of approaching health disparities, it really does. They really are a leader in the area of innovative approaches to population health. And here on the border, the issues that we face are really best addressed through comprehensive approaches that include all of the social determinants of health, such as keeping people in school, having people have access to basic healthcare needs and screenings and prevention intervention services, increasing opportunities for people to stay in school, continue in school, increasing environmental health interventions and our understanding of how environment impacts health, providing more opportunities at the neighborhood level, better access to nutritious foods and safe places to walk and exercise. And, we know all those connections are there between where we're born, where we grow up, where we live and work and play. All of those things that we call the social determinants of health are so important in terms of population health and just, and how we address health needs in our world. And I think the Health Disparities Research Center is really at the forefront of helping people in this region and around the world understand how we can use innovative approaches to starting at the ground level and addressing all of those social determinants that have such a huge impact on population health, rather than the clinical interventions that happen once people are already sick and that really affect such a small percentage of people. And that's that's kind of the beauty of health education, is we get to have this great big impact on a lot of people, and really, I think one of the things that the center is really doing is giving us the opportunity to evaluate the impact of some of those far-reaching interventions through their work with promotoras, through their work with community health programs that that are really just now, for the first time in the last decade or so, being rigorously evaluated and having the results disseminated widely. So I think also through the ways that they support our health education and evaluation efforts in the community. You know, they really do, although they're a research center, they really do have a big emphasis on providing opportunities for students, for community members, for everybody to get involved in health disparities education and research.
Well, thank you for your time and effort, Holly, and we appreciate the work you do in our community.
Likewise, thanks, Sharon.